As far as governments are concerned, the constant building up of the fear has worked. Most people are surprisingly happy about being locked in. They're enthusiastic about possible vaccination. They're watching far more television than ever and drinking more booze than ever. They're taking very little exercise and they're eating quite a lot of food, most of the wrong sort of food. Nevertheless, it's been clear for quite a while that the coronavirus fiasco is either the biggest cock-up in history or the result of a conspiracy. I've given my views on that on my website, where there's more space to discuss things and give background facts. Some pathologists have decreed that dead patients who have the coronavirus must now be cremated without examination. I've seen a briefing which states, quote, "If a death is believed to be due to confirmed COVID-19 infection, there is unlikely to be any need for a post-mortem examination to be conducted, and the medical certificate of cause of death should be issued," close quotes. The key word here is surely believed, if a death is believed to be due. Knowing that nowhere near enough people are dying of the coronavirus to justify the oppressive new measures they've introduced, the authorities are quietly making sure that most of the people who die, or at least a large number of the people who die, are being classified as coronavirus deaths. Indeed, there's some evidence that people are being classified as coronavirus victims without ever having been tested. And it seems that Britain, for example, is doing what the Italians did. If a patient has the virus and they die, then they died of the virus. But I suspect Britain's going one step further. If someone who dies is thought to have had the virus, or might have had the virus, then they're coronavirus victims and their death is added to the total. The lack of any testing, or any real extensive testing, makes this easy. Today, it's clear, to me at any rate, and to a lot of other people, that the cure, not the problem, is causing the crisis. Right at the beginning of this coronavirus affair, I pointed out that according to the World Health Organization, the ordinary flu kills between 250,000 and 600,000 people a year, most of them in the winter months. I said that if the coronavirus hadn't killed between 100,000 and 150,000 people around the world by the middle of April, then it would be clear that it wasn't as dangerous as we'd been told, and indeed not as dangerous as the flu. Well, the authorities are now claiming that the death rate from the coronavirus has globally reached 100,000. So, is the coronavirus as deadly as the mathematicians and the politicians said it was going to be? No, because they've fiddled the figures. Today, anyone who has the coronavirus, or is thought to have it even though they've not been tested, will be put down as having died of the coronavirus. Time and time again, the authorities report that someone died with the disease, not of the disease. And yet those patients are put down as having died as a result of the coronavirus. What this means is that if you fall downstairs and break your neck, but you had a cough before you died, then you're likely to be classified as a coronavirus death. If you had a heart attack, but were thought to have the coronavirus, then you officially died of the coronavirus rather than the heart attack. A lack of widespread testing makes this possible, and postmortems have been abandoned for many patients. Proper widespread testing was vital right from the start. It's inexplicable that this hasn't happened. In my second video, I explained why the Italian figures for coronavirus deaths can't be trusted. Indeed, 88% of those who officially died of the coronavirus almost certainly died of something else. The details are on my website. The evidence for that is all there. And in the UK, Imperial College, which originally forecast that the coronavirus would kill 500,000 people in the UK, has apparently admitted that the figures that they're now expecting are under 20,000, and that two-thirds of those, two-thirds of the people who'd been listed as having died of the coronavirus would have died anyway of something else. I've no doubt that the figures have been distorted in the same way in other countries. So, using figures from the UK and Italy, the total worldwide number of deaths from the coronavirus is at most probably between a quarter and a third of the alleged current total. That is, it may be between 25,000 and 33,000, but it's probably considerably lower. And now that's a lot of people, and it's a tragedy, and it obviously means that we can't not take the coronavirus seriously. What I'm questioning is how seriously we're taking it and what sort of measures governments are taking, and are those measures appropriate or not. The fact is that the coronavirus certainly now appears far less deadly than the flu, and it's certainly absurd to compare it to the plague, as has frequently been done by rather hysterical commentators. The plague, let us remember, killed 40% of the population when it swept through Europe. And to compare the coronavirus to the Second World War is an insult to those soldiers and civilians who lived through those terrible years. Fiddling the figures is the final cruel deceit to sustain the fear and to excuse the new totalitarian tactics which are being used to keep us all quiet. Meanwhile, it's now acknowledged that, as I wrote some time ago on my website, the number of people who've died as a direct result of the restrictions brought in by governments will far exceed the number of people who will die as a result of the coronavirus. The British government has now admitted that the side effects of the cure, the lockdown and so on, will result in 150,000 unnecessary deaths in the UK. That's the government estimate. Regular readers will remember that on 30th of March I suggested on my website that the unnecessary death figure in the UK would be between 100,000 and 250,000. No one is now suggesting that there will be anywhere near that number of deaths from the coronavirus in the UK. Globally, the lockdowns and other measures will doubtless result in millions of deaths. A senior NHS official has already expressed concern that sick children aren't being treated because of the coronavirus cure, and the United Nations estimates that worldwide 25 million jobs will be lost as a result of the coronavirus. Some claim that the figure could be as high as 190 million, and when unemployment rises, so does illness and death. Actually, virtually no jobs will be lost because of the virus. It's the lockdowns which are going to cause all those job losses, all that pain, and all that massive poverty. Every fact I've provided has been absolutely accurate, and every prediction I've made has been proven accurate. The details of everything I've said and written are still on my website. So why don't the authorities admit they got it wrong? Even if they wanted to, the scientists, the advisors, the politicians and the media are now wedded to this deceit. Even if they wanted to, how could they possibly ever admit that they got it so very, very wrong? But there's another danger that no one seems to have noticed. By exaggerating the number of deaths and allowing the figures to be falsified, the governments around the world are endangering us all. You can't learn anything about a disease when you don't keep proper records. I suppose the world's governments could have made a bigger mess of dealing with this virus, but I can't see how. And no one seems now to have any idea how they're going to get out of the lockdowns, how they're going to stop them, how they're going to get rid of the fear, how they're going to stop people being terrified of a virus which is still going to exist when the lockdowns have ended. The evidence that the coronavirus has been exaggerated is all around us. In the UK, the government admitted just a while ago that the NHS has 2,295 empty intensive care beds. The average number of empty intensive care beds before the coronavirus crisis was 800. Obviously these figures change all the time, but the implication is massive. So the NHS has 1,495 more empty intensive care beds during the coronavirus crisis than it had before the so-called crisis began. As I said, obviously these figures change slightly, but they're not changing massively as far as I know. And it's been reported that almost half the beds in some English hospitals are lying empty. Whether you believe it's a cock-up or a conspiracy, we're heading for a manufactured coronavirus apocalypse. The sources for those figures, by the way, are on my website. The lockdown and totalitarianism is troubling, but I fear that we're in the middle of a calm before a manufactured storm of unprecedented ferocity. This video, like the first two which I made, has not been monetized. In other words, we don't make any money out of it. And if you see ads on or around the video, then it's been taken by someone else and could have been tinkered with. There's more information about the coronavirus scandal and a variety of other scandals on my website. Thank you for watching.